Knee orthosis casting technique. Please follow these casting instructions when ordering a custom knee orthosis. A quality cast allows us the best opportunity to create a brace that will fit your patient perfectly. Before you begin, make sure you have the necessary materials: fiberglass or plaster, cut strip, stockinette, spray bottle or bucket of water, surgical scissors, cast saw. The technique we are going to demonstrate in this video is a traditional casting technique. We recommend you start by filling out the order form, as your decisions on the brace fabrication may impact the cast you are taking in terms of the length and position. Start by placing the stockinette and the cut strip on your patient. We recommend the cut strip be positioned on the posterior aspect of the leg. Adjust the patient position to terminal extension and ask the patient to dorsiflex their foot. Be sure patient is non-weight bearing, full extension, and in dorsiflexion. Start casting the patient with fiberglass. Make sure to make the cast 2 inches longer than the desired length of the brace. We recommend having a minimum of 3 layers of fiberglass throughout the cast, from proximal to distal end. This process helps to maintain the cast's geometry during shipping, handling, and filling. Once the cast is almost cured, mark the landmarks on the outside of the cast: fibula head, patella, medial and lateral condyle, plus deformities, scar tissue, and any other area of concern. Remember to place hash marks over the cut strip as well. Once you have removed the cast, check that the height of the cast is consistent with the desired brace length. Depending on the knee orthosis model that you selected, you may draw the brace trim lines on the cast. We also recommend you add your Thuasne USA Townsend account number as well as the patient name on the cast. Wait at least an hour before putting the cast in a box for shipping. Please remove the stockinette before shipping. Stuff the cast to maintain its structure during shipping.